this is Prostate Cancer and Prostate Health Awareness Month, and so the bulk of what I do these days is prostate cancer care. So just some background statistics. So the rate of prostate cancer is actually growing, and it's actually projected to be one of the most common cancers. Right now, it's the most commonly diagnosed cancer among American men, and worldwide, they see that becoming the most commonly diagnosed cancer, period, in excess of breast cancer as well. And that does not include skin cancers. So it's the number two killer of men in the United States. Thankfully, those rates have plateaued, and when we talk a little bit more about some of the treatments we're doing and the advanced imaging and diagnostics that we're doing, it'll kind of make a little bit more sense about why that level is getting better despite the number of diagnoses going up. So, for those who have male significant others and for the men in the room, the important thing to remember is screening is important, and early diagnosis is important because it leaves you in the driver's seat. The last thing you want to do is to be caught behind the 8 ball, and then the cancer is dictating for you what your options are rather than the other way around. But yeah, we recommend that men the prostate cancer screening involves a blood test, right? A PSA blood test. It's easy, it's inexpensive. We do prostate exams, although interestingly our guidelines are changing, so that's becoming less and less frequently required. And so if men are just afraid of going to the doctor because they're going to get an exam, and that's the big hold up, we're doing that only in select circumstances now, so you can reassure them. But we should recommend PSA testing at least between the ages of 55 and 69. That's where we're probably going to do the most good from a prevention standpoint. The actual screening guidelines vary from organization to organization, right? So some people say if you've got a family history of prostate cancer, like a dad or a brother, you should probably get a PSA at the age of 40 is like a baseline. But at 40, and then you usually risk stratify. The numbers look really good. You probably don't need repetitive screening until you're 45, and then 50 and over is usually the annual checkup type thing, like for most things that your primary doctor will do. We use the PSA as a screening test, so a lot of people will ask me, what does that blood test mean for me? And is it high? Does that mean I have cancer? And the answer is no. It's just an indicator of like prostate activity, and just because it's elevated doesn't mean you've got cancer. You have to interpret that blood test in the context of everything else, and then probably do a little bit more testing before we start talking about other types of advanced testing like MRIs and biopsies and things like that. We do a lot of MRI now as a non-invasive way. Guys sometimes fear, war stories about, having an abnormal PSA and having to have a biopsy to rule out cancer. We do a lot of MRI these days to try to avoid that, and I use that more frequently now than I ever have before. And thankfully, insurance covers it now. And so I do way more MRI than I ever did biopsy before. Our treatment options are improving. We still have surgery and radiation if men need to have treatment. Let me take a step back. The majority of guys I diagnose with prostate cancer these days, I don't do anything to them. I just put them on active surveillance because often the cancer is not aggressive enough to justify some of the treatment side effects. Obviously, if a man's cancer is bad enough and we're worried about it getting worse and putting his life at risk, then we need to take some risks, both surgically or radiation-wise, to make that better. But for the majority of men, it's such a slow-growing process. When we do need to have treatment, there's really 2 big options. One is surgery to remove the prostate. We do that mostly robotically. So that has defined my career. It will define my career until something comes along and makes me obsolete. And I'm sure it will in the next 10 to 15 years. Radiation still is a good standby, and it's not your grandfather's radiation anymore either. It's way more sophisticated than it used to be. Thankfully, most men don't die of prostate cancer, and with a lot of our new imaging studies, PET CT scans, for instance, we're able to understand the disease state better than we ever did before. The big things we always worry about when treating prostate cancer are like urinary issues and sex issues. But thankfully, most men who are taking care of themselves, eating right, maintaining a good weight, doing cardiovascular exercise, staying muscle positive, end up doing really well with those types of side effects and things. So I always tell all my patients, look, you're probably I may diagnose you with prostate cancer, I may treat you for it, but you're likely to add more years to your life than I ever will by eating right and protecting your heart, because statistically you're more likely to die of a heart attack than you are to die of prostate cancer. So if you treat your heart right, you're going to treat the rest of your prostate right.